Good morning, and welcome to FIU Insights. I'm Ileana Borella with the Herbert Wortham College of Medicine, and I'm being joined today by Dr. Eneida Roldan. She is the Chief Executive Officer for the FIU Healthcare Network, and she is joining us to try to answer some of the questions that you have at home, which you have shared with us through our online social media platforms. So Dr. Roldan, I know you're extremely busy in the midst of all of this. So welcome and thank you so much for joining us, because there is a lot of confusion, there's a lot of anxiety, and people do have a lot of questions. So thank you for joining us.
No, my pleasure, Ileana. I'm very happy to be with all of you here today in such challenging times.
Dr. Roldan, obviously we're doing this remotely. One measure that the internet pretty much has taken almost full control of our lives in the midst of this crisis. And because that has growingly been true anyway, but because so many people are relying on the internet for information regarding the virus and the crisis, it's good that there's so much information out there and people can be informed at all times. But there's also a lot of misinformation, and unfortunately, in some cases, even fraudulent information. What would you suggest people do in order to get their information from reputable places so that they can make the right decisions regarding their own safety?
Absolutely. Well, we know and we understand that whenever there's a disruption to any type of societal norm, there will be individuals and there will be companies and so forth that will be able to try to engage in individuals with the fear. Therefore, it's extremely important that the public understands that, especially with something that is medically aligned, that is really the science and the experts that are important that we have to go to. In other words, the CDC, Centers of Disease Control, has an incredible and very, very educational website where on a daily basis, they're updating news, they're updating information, not only for the lay person, but also for healthcare providers and scientists around the world. So it's extremely important that individuals just don't go to any site that are claiming that if you take this, if you eat this, if you do this, you will prevent the virus. We understand that humanity is as such that when they're fearful, they want to hear what they want to hear. And right now it's extremely important that society really educates themselves, but understand that it is through evidence-based the only way that we are going to educate the public and make the public understand what is really the truth behind the virus.
Yeah, sadly, a lot of people are trying to make quick buck off of, obviously what is a worldwide crisis. There's all sorts of silver bullets out there, including, in fact, liquid silver and other things. People really need to be aware of basically what are scams.
Absolutely. I dislike to use this word, but this is not a fad because the virus is not a fad. But this, as you know, happens in other conditions in medicine. And people want a quick result, a quick answer. And I'm here to say that right now, this is a day-to-day phenomena. And the only thing that I, as a physician, would like the population to understand is that we will have the answers. It's going to take time, but it's extremely important that we're all in this together. And this is truly teamwork. I want to use a word that the WHO came up with, and I thought it was incredible. It's called the infodemic, which means that we have an epidemic of information out there that is not true. So we need the population to understand to go to the true scientific basis, and the CDC is one website that I truly recommend.
So, let's try to combat some of this infodemic with real information. I'm going to start asking you some of the questions that we've been getting from our online viewers. Here's a question that we got through Instagram. And it's a question that a lot of people are still asking, even though the information, the factual information has been out there for a while. But people still want to know, when and how long should they self-quarantine?
From the time that the individual has been told by a medical professional, healthcare provider, that they need to quarantine, It's 14 days. And why is this? We know that the incubation period of this virus is anywhere between 2 to 14 days. But it's also very important, it's not only the time, it's what they're supposed to do. There is a lot of false information that once you are told to quarantine, basically you stay home doing your routine task. That is not the case. There's specific guidelines that are set by the providers, by the healthcare providers and scientists of what you're supposed to do when you're self-quarantined. What does that mean? You could stay in your house. That means if you are one of that healthy group that is able to stay in the house, but you have to be completely separated from all the other family members. You have to stay in your room. You have to use your own bathroom. You have to use your own utensils. You have to continuously wash your hands. You have to wash the surfaces, etc. So there's there's very specific guidelines. It's not just staying home and walking around, because you have then the possibility of infecting your other family members. Especially this is true if you live in a household with the elderly. We know that the elderly population is one of those vulnerable groups that are to get very, very sick. However, as I said, every day is a news with this virus. We now are seeing that also the youth is getting very sick. So no one is spared.
So I think there may even be some confusion, Dr. Roldan, as to the difference between self-quarantine and just staying home. Right now, you and I are staying home, but we are not really quarantined. There is a difference. Self-quarantine means you are a potential carrier.
Correct. That is correct. Which means is what is following the guidelines that I alluded to earlier, mm-hmm. which is you're in your room locked. Anyone that will bring you food or will bring you any of the items that you need should leave it outside. Should leave it outside your room, because we still have to follow the distancing, social distancing, which as we know, as set forth by the CDC guidelines, is greater than 6 feet. So therefore, they have to leave everything outside. This person obviously will be opening the door. You have to clean the knobs. You have to consistently be cleaning with detergent, with water, with soap. You also have to be using alcohol-based products. So therefore, it's not as easy as just walking around the house. You also have to, if possible, be using a different bathroom, different towels, different utensils. So it's very, very specific guidelines that the individual has to use. There's another item that is extremely important. We know that across the country, especially in our own FIU community, we are working remotely. We may have individuals that are working remotely in the house with individuals that are self-quarantined. So again, I'm going to repeat again that the self-quarantine has to be separated from working remotely. In addition, a self-quarantine individual, for many, many reasons, may not feel sick. It may be just a potential case. That individual can continue working remotely. But again, with following the guidelines of cleaning surfaces, cleaning your computer, cleaning your phones, etc.
So for the many other people who are not quarantined but are staying home because of the circumstances, there's obviously a lot of chatter going around. And quite frankly, the weather is beautiful. Is it okay for those of us who are not quarantined but are staying home to go outside? And if so, what precautions do we need to take?
Well, absolutely. I mean, if you are fortunate to have a yard with a day like this, the sun is very good for several reasons. Number one, when the sun hits your skin, that means that you are enhancing your vitamins. We know about vitamin D. We know about the fact that people feel very happy in the sun. That's also with the serotonin. So it's extremely important, and I would encourage families out there that do have a yard, go out, get fresh air. Very important to continue with the social distancing. That means if you want to play ball, if you want to play a sports, you have to be separated from each other. But absolutely go out and walk. Obviously, the person that is self-quarantined does have to stay indoors in one room. But those of us that are working remotely, in order to reduce cabin fever and in order to feel happy and enjoy a beautiful day like today, I would encourage you to go out there, especially with children. Children need activity. They should be out there, they should be playing, and this is just the right time to spend some time with family.
So anytime we travel outside, this question comes up. And of course, we did get a question about this, and it goes back to masks. Why are we being told it's not necessary for us to wear masks?
Masks are only worn, and this let's just first of all, let's distinguish what type of mask. An N95 mask, which is the one that you have seen, or the respirator mask, is only worn by healthcare workers. These are the individuals that are at the front line, the individuals that are exposed directly to patients that could be affected by the virus. The next one is the surgical mask. We've all known it's a simple surgical mask. And again, you also need to wear it. There's great videos online of how you're supposed to wear the mask. The mask is only worn when you are sick. It is for the individual that is sick. However, there could be a possibility that you might be in an enclosed area, let's say airplane, and you could go on an airplane and you may have an individual next to you that could be coughing. I have at times recommended then although you're not sick, in order to prevent those droplets to hit your face and your skin, it might not be a bad idea to wear the mask. But that is in very, very rare cases. In general, only the sick individual, the sick person, is to wear a mask.
Okay, this question that we got, I think, is right down your alley because you're also board certified in obesity. You had a weight management practice for many, many years. I know you're an expert on nutrition, and this person is asking, what foods should I eat to prevent from getting the virus? I know that nutrition is very important just because healthy people tend to get sick less, but specific foods?
No specific foods, no evidence-based. Again, those are claims that are out there that are trying to get you to have specific vitamins, specific foods, no scientific evidence-based on that. What is very important though is a food, I would say, a nutrient, something that some of us may not like that much. It's called simple water. Hydration is extremely important. Even we do that when we have the flu. So any healthcare provider will tell you that you need to keep yourself extremely well hydrated. In addition, as we just alluded to, if you're out there in the sun, you will get dehydrated more frequently. Therefore, you need to be able to notice how much water intake you have. So that is important. I would say if there's anything that is important, is water.
So we have a question that, again, is a very frequently asked question. Do we have a vaccine yet?
We do have experimental vaccine. In fact, on March 16th, there was the first volunteers that were up and they were administered the vaccine. As far as for the general public, we're seeing possibly 12 to 18 months. As you know, we have a very rigorous FDA process where we have to do population-based experiments or population-based approach, and therefore this is not something that we're going to have overnight. But we are starting to work on that, and on March 16th, the first volunteers were administered this vaccine.
What does the recovery process look like?
Very interesting, because viruses and even the flu, that we have all have had the flu at some point, they affect individuals differently. So therefore, if you have been fortunate enough to be that one of 80%, which is a mild to moderate, after your 14 days, you may feel much better. You may see that day after day you're feeling better. However, within the 14 days, it could be a cycle. You could start with very mild symptoms, and then you start with very aggressive, drastic symptoms, the fact that you may not even be able to wake up, and then you have a better day. What is very important is that individuals think that once they feel okay, and okay is defined by many in a different way, that they're ready to go out even before the 14 days. That is not recommended. So if you were a confirmed or are a confirmed COVID patient, that means that you have a test that has been confirmed positive. You go through your 14 days. You may go through cycles of good and bad days, but the most important thing, that what is the wellness or good, means that that individual after 14 days has to test negative 2 times. So you could have individuals that they have no symptoms after 14 days. However, when we test them, they can still be positive. That does not mean the individual is out of the woods. They still have to stay and follow the self-quarantine. So it's extremely important that we also understand who is confirmed and who is doing this just by mild flu-like symptoms that may not have been tested by healthcare providers.
So I want to talk about the symptoms in just a moment, because we are getting questions about that. But what you just said brings up another one of the questions, which is, can you get COVID-19 more than once? In other words, we're talking about the recovery period. Say you recover, is it possible to be reinfected?
Well, as you know, this is a novel virus. This is from a group of viruses that we know, but this one in particular, this strain, is novel. There is some studies, and I believe I can just think of maybe one out of Japan, of a particular individual that, according to what they have documented, this individual, which actually was a lady, if I recall, she was diagnosed by positive test of COVID-19, went through her quarantine, felt better, went out again, started feeling ill again, and therefore tested positive again. I would say that there's many variables in that. There's variables because, as we know, with any scientific test, there could be a false positive, false negative. It is very early yet for us to determine what is the sensitivity and specificity of this particular test. So therefore, as of today, scientifically driven, we have not confirmed that you could be affected by the coronavirus twice.
And I guess it's worth noting the reason that it's called a novel virus, because novel meaning new, and because it's new, we just don't know a lot of these things and will not know until some time elapses.
And Ileana, that is the reason why what we are asking of the population is to follow rules, follow guidelines. It is extremely important that we have to be patient. We will have the answers, but we need the help of the entire population. We need the help of our leaders. We need the help of everyone to understand that you may not die from this virus, but because this is a population-based approach, each and every one of us play a role.
That's an excellent point. Let me go back to some of the questions. Is it true that heat kills the virus?
This again goes back to saying that during the summertime, we tend to have less flu, which is really less, but that does not mean we're completely out of the flu. We do have a flu season during the winter that we know that is very prevalent, and this is the reason why we all, yes, need to get vaccinated against the flu. Notwithstanding, there's other variables that are incorporated in that statement. Number one, during the winter, of course, we don't want to go out. Of course, we want to stay home. Therefore, we're really not practicing social distancing. We are in our house, we are together, we bundled up, and therefore the viruses love that. They love to be able to have people together so that they can affect one person with the other. In the summer, it's different. In the summer, we're out, we're playing, we're running, and therefore social distancing is a lot more prevalent in the summer than it is in the winter. As far as the heat killing the virus, we know that there could be a lower viremia in wherever surfaces or even in food that might be that food may have it based on someone coughing. But there is no scientific evidence that heat would completely eradicate the virus.
So one of the things about, we talked about cabin fever and the idea of being able to go outside, break the monotony. There's also a lot of anxiety because this is unknown. Many people have never been, some people are of an age that they've never been through anything like this before. How do you combat that part of it? We see people going out and buying up toilet paper and buying up bottled water when you can still go to your faucet and get water, and when we are told that supply chains are still intact, and you don't need to be hoarding supplies. Obviously, there's a lot of anxiety out there. Um, how can people combat that?
Well, first of all, and everyone needs to understand that is being human. We as humans feel that we can control everything. And therefore, whenever there is something that we can't explain, cannot understand, we tend to do what we feel happier, not only happier, but safer in doing. That doesn't necessarily mean is right. This is just purely human behavior. The fear is normal because why? We tend to look up, especially when there's something related to medicine, we tend to look up to our healthcare providers and to science to give us an explanation. And we know that even science at this point is learning as we go. So first of all is to understand that that reaction is normal. No one should be accused or penalized by the fact that they feel fearful. But we have to stop and think and have a little bit common sense that again, this is time. This is just like the times of the epidemics in the past that no one knew. And guess what? We got out of it. So therefore, what we need to do is we need to pause and we need to rest. Our President Rosenberg, has said it many times, this is a new normal. Guess what? In any disruption, whether it's in business, whether it's in science, what we need to do is we need to find opportunities to think differently, to do things differently. And I think this is the time. This is the time to do it. I truly believe that in everything around us, we're going to need to do things differently, not just because of the virus. It's because, guess what? This may be a wake-up call.
So, so this question goes back a little bit to the question about whether the virus is killed by the heat. We know that in winter is flu season, and people are wondering what are the difference in symptoms between the flu, allergies, which are also beginning to kick in this time of the year,
Yes.
and COVID-19.
Well, first and foremost, everyone knows what the flu feels like. The aches and pains, which again, you can see that in COVID-19. You may have a cough. You may or may not have it in the flu. You may have a fever. I will tell you, a very high spiking fever is pretty prevalent in COVID-19, except it depends, again, it depends on the group. For instance, the elderly sometimes may not spike a fever. So therefore, they're very, very what we call nonspecific. So as far as the symptoms are concerned, you may have very similar symptoms. The difference is that now we know that there's specific details of the COVID-19 that may not be part of the flu. Although I will tell you, for instance, let's look at travel. Well, you may be more predisposed to getting flu and colds when you travel, because you're with a different people, you're with people you don't know, you're in surroundings that you don't know. You could be in hotels and going to places that you have other individuals with the flu, and therefore you could be affected by the flu. The difference is we know that there's a vaccine for the flu. Therefore, we know that we take personal responsibility whether we take the vaccine, where we get the vaccine or not. We know that if we don't take the vaccine, guess what? We may be affected, and we may be affected in a manner that is even stronger. But if we do take the vaccine, we know it could be milder. This one, since we don't know, that's where the fear comes in. Another thing is, with the flu, there is something called the herd immunity. Herd immunity is because there is a vaccine and populations get administered the vaccine, we have a protected factor. At this point, just think of it as that we are completely exposed to this virus that, as we know, could affect us in either mild, moderate, or even death to some of the individuals, to some of the groups. So that is where the fear comes in.
So another question, which I see cropping up time and time again, has to do with these similar symptoms. Because the flu and COVID-19 are both viruses, but they're different viruses. People want to know, can you actually get the flu and COVID-19 at the same time? And if I'm a patient who feels bad enough to go to the doctor, or I have been in circumstances where I feel I may have been exposed and I go to the doctor, what can I expect? If I have flu-like symptoms, am I going to be automatically tested for COVID? Do you test for the flu first, and then if you rule that out, then move on? Or how are you approaching that?
By in general rule, at the same time, and this is very general, viruses don't like each other. So therefore, very unlikely, and again, I say unlikely because again, we're very, very early into the science and pathobiology of this particular virus. Very unlikely that you could have both. I will tell you what is being done, and we're doing that in the clinic. When a patient comes in and we go through a very, very detailed questionnaire that involves all the guidelines as set forth by the CDC. And therefore, because they have these flu-like symptoms, and to your point, they could be flu-like, and who knows, they could be on the mild group of the COVID-affected group, we do a flu swab. And a flu swab, within 15 minutes, we know or we don't know whether it's the flu. Now, if it's negative, does that mean that there's more probability of that patient being COVID? Not really, because there's other flus that we don't test for. So therefore, we do it because it gives peace of mind. If the flu test is positive, then because we know that in extremely rare, almost non-related, the flu and the COVID virus can live together, the patient feels better. And then it's treated as a flu. If it's negative, then we go on to the next step. But I will tell you, Ileana, right now, again, more and more science is needed and more evidence is needed as we start testing what this virus can do, and more importantly, what this virus can do in the environment of other viruses.
Dr. Roldan, I think you've touched on this already, but again, I think here's another question that people, I have a feeling that they're still struggling with as to exactly how COVID-19 is spread. Is it because you mentioned food, and there's surfaces, and then there's the coughing and the air droplets. Can you address that specifically?
Absolutely. We have had some documentation. We have documentation. The fact that this is in the air, it is spread. It could be aerosol, and it stays in the air for approximately 3 hours. What does that mean? You could cough, and you may have droplets, but also that goes into the air. So that the virus stays about 3 hours and under those conditions. That is the reason why we cough. You got to do it correctly, not into your hands, but into your sleeve. So that's where that comes from. If you feel you just have a regular cough, especially in the environment that we're living in, use a mask. That is very important. Why? Because of their droplets and the fact that the virus can stay in the air for about 3 hours. In addition, you could be around surfaces. There's different surfaces. There's copper, there's steel, there's plastic and cardboard. I know that there's been a few claims that that people don't even want to accept boxes in their home. Well, we know that the virus lives in cardboard for 24 hours. So what are we telling? In an abundance of caution, if you're receiving any package for whatever reason, leave it outside for a day. Just leave it outside in the air for about a day, and then open it up outside your home. Wash your hands before, open the package, throw away the cardboard, go in, leave it on the floor, wash your hands again, and then deal with whatever is inside the package. We know that in plastic and in stainless steel and in other surfaces, it may live as long as 3 days. And in copper, it lives around a few hours or so, 4 hours or so. So it is important. Surfaces are extremely important to keep clean. But then again, I ask myself, why are we here faced with this challenging time and telling populations and telling people to do what we are supposed to do all the time? So again, the new normal is what we normally should have been doing all the time.
wash your hands, you know, have certain level of hygiene. You're right. I mean, what's new about that?
Absolutely. Absolutely. It's most unfortunate that we tend to face a crisis to take us back to basics. And this is what we're seeing.
So getting back just for a moment to the surfaces question, um, about cleaning surfaces. People have heard that one of the positives in all of this is the fact that the virus is easy to clean. Is that true?
Can you repeat that, Ileana? You cut off a little bit.
Yes. People have been hearing that the one if there is a positive in all of this, maybe the fact that the virus is actually easy to clean from surfaces. Is that true?
If we follow guidelines of how to clean our surfaces and in understanding how long the virus may live, yes, detergent, soap, water, or any alcohol base, approximately 70% alcohol, would clean those surfaces. So if you have any of those surfaces around, by the way, surfaces also means we do open doors. So that's important. Doorknobs. We do have computers. Computers may have steel, may have, so we have cell phone. Individuals don't understand cell phones. You could put it on speaker. Lately, I've been putting my cell phone on speaker. Why? Because you put it close to your face. We understand we shouldn't be touching our face and then doing other things. So absolutely, yes, we could prevent and we could reduce the life of the virus if we start cleaning all those surfaces, understanding how long that the viruses may live in those different types of surfaces. But nothing special. Soap, water. Again, Ileana, we go back to basics. The normal is what we should have been doing. Is to drink water. How simple is to enjoy the outside. How simple is to wash our hands, and how simple is to prevent and cleaning our surfaces.
I have a very specific question here, Dr. Roldan, from someone who writes, ACE2 is an entry point for the virus. How does this affect patients on ACE inhibitor medications? And what are ACE inhibitor medications?
That comes from the fact that the virus binds, and this is how the virus enters into the body. And this is extremely very simplistic way, not going into the very complex way of how the virus enters the body and what it binds with. So what has been said, and it is not true, is that individuals on ACE inhibitor for their hypertension should discontinue. That is not correct. On the contrary, a hypertensive individual on those medications should not, and I repeat, should not discontinue their medication. So all cardiologists, board certified cardiologists, et cetera, have said that is something that should not be done. In fact, you will have further effects and further morbidity if that happens. Not of the virus, but on your condition.
So it could actually be dangerous if people follow this erroneous advice.
Yes.
So I'm going to let you go, but I have to ask you this because, again, going back to the fact that in management and nutrition, this is actually one of my questions because I've been working from home for a week. I noticed that the refrigerator is right there. The pantry is right there. There is sometimes that urge, and I guess it also part of the anxiety that we're all going through, urge to snack. And I'm not the only one who is faced with the prospect of gaining weight while working from. What do you say?
Well, there's several tips that we can follow. For instance, we're all working out of our computers, our cell phones, our iPads. So stand up, don't sit down, stand up. You could be on a conference call in a meeting. Walk around the house while you're on the phone. Go outside. If you cannot go to the gym, because yes, gyms are closed, and yes, gym is they could be a petri dish, and we understand that. So try to do it at home. I've also had questions, by the way, Ileana, about the pool. Go in the pool. That is not, that
Mm.
doesn't have any evidence whatsoever that you could have the virus there. So, do things outside, take a break. This is not only because of the aspect that you could gain weight, but also mentally and spiritually. It's extremely important that we stay balanced, because we are overloaded with information. And most of that information, I would say, we have to screen through it, because there is a lot of opportunistic individuals and companies out there that really want to engage and really want to capture the fear of the population. Please, please stay informed. Look at the science links, look at the evidence-based links, such as the CDC. Stay informed, be with your family. This is the time that we need to think how we're going to change, how we're going to change our personal lives, how we're going to change our workforce, how we're going to engage in the next generation of a new normal. It's extremely important. The only thing as a physician, I always fear, could this be the first wake-up call? And could the next one be worse? So let's be ready, let's engage, put fear aside, and let's get to work.
Well, on that note, I want to thank you again for taking out a little bit of time. And I know you're extremely busy. People at home have no idea all the things that you do all day, and we appreciate you taking the time to answer their questions. Because again, there is a lot of misinformation, fraudulent information, and anxiety about what is to come. What do we do? And really appreciate someone with your expertise answering those questions for us. Thank you, Dr.
It is
Roldan.
truly my pleasure, Eliana. Thank you very much. And you all have a wonderful Saturday, and go out and enjoy the sun.
Thank you.